Meanwhile, I'm just doing live, and then after we
That's
are
right.
good.
Perfect. Perfect. Yeah, that's right. Samiji should be joining, and she fell asleep and turned her phone off while she's sleeping, so then she didn't wake up, or I think she was very tired from the Sunday.
Uh-huh.
Forgot to turn the cell phone back on. She called me afterwards.
Okay.
Poor Samiji. It's okay. I was thinking you're okay. You got Wi-Fi now? I was worried about the Wi-Fi wasn't working.
Uh-huh. No, no,
I was,
no, 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 that's fine. No, no worries.
yeah.
So we are ready for live. Okay, anytime, Anuja, you can start. And I make you spotlight for everyone. Okay. Yep, we can start.
Okay, I will get started. Good evening, everyone. And I guess everybody knows me now. I see the same faces as yesterday evening. So to follow up for today, what we talked about yesterday, want to talk a little bit about treatments for anxiety disorders because we just talked about the different types and symptoms and a little bit about what causes these conditions. So the goal for today is to break it down into three different types of what we call interventions or treatment. First, I'll talk about behavioral treatments, and that's kind of what we start off with first. Then we will do medications, and most of the patients that I end up seeing in my practice and my trainees, we do medications for most of them, but in general, most people don't really need them. And then I want to address some evidence base for complementary interventions, and I know somebody can probably talk more about some of those ones. So to start off with behavior therapy, for anxiety, these are evidence-based treatments. There's a lot of research behind them, and they are very effective if patients are able to receive them from people who are qualified. So cognitive behavior therapy, or CBT, is very well known, and it's used for generalized anxiety disorder and social anxiety disorder. There's different types of therapies for different anxiety disorders. So you're not going to just do the same thing for everybody. And that's why you have psychologists, PhD level psychologists are typically specialized in different types of anxiety disorders. Sometimes you have general counselors, they'll just talk to people and do supportive work. But in this case, I'm talking about very specific manualized treatments. Then we have something called exposure and response prevention, and that we use for obsessive compulsive disorder. We have prolonged exposure. We typically use that for PTSD, and we have other therapies too. These are not the only ones, but these are one of the most common ones or the first line ones. And then we have desensitization, which we'll use for panic disorder. So what I've done is it's really hard to explain what these treatments are. You just have to do them. And what I did was I found very brief YouTube videos to at least illustrate broadly what we are trying to achieve with these therapeutic modalities. So for cognitive behavior therapy, it's cognitive. So that part addresses the thoughts, the negative thought pattern that is there in people's heads who struggle with anxiety because they are thinking negative. That's sort of very obvious as you talk to them and as you realize what's happening to them. And there's ways in which you're going to target them and try to challenge them and hopefully replace those negative thoughts with neutral thoughts, not always necessarily positive, but more neutral, more balanced thinking. The therapist will also help patients pay attention to their thoughts, notice when they're getting into those negative thought pattern. And then the behavior part, so there's a C part, which is cognitive. The B part is behavior. You're going to change their behaviors to alleviate anxiety. And you can achieve that either through exposures, asking them to do things that make them anxious. And if you do those things, then your anxiety will reduce. And the other thing you can do is you teach them relaxation. So even if something is difficult for them, if they learn to relax, it can become easier for them. And what I'll do now, I see that Samniji has joined too. I had prepped the YouTube videos for each of these. So just give me a second to pull these up. You know what? Let's just try this. Okay, so I know it's a regular screen here. Let me try this one first.
Hi, friends! Today we're going to talk about something called the cognitive triangle. This is a super helpful CBT tool that shows you how your thoughts, feelings, and actions are connected, kind of like a triangle where each side depends on the others. Think of the cognitive triangle as a special tool that helps you understand why you feel and act the way you do. Each point of the triangle represents something different. One point is your thoughts, another point is your feelings, and the third point is your actions. Let's explore how this works with some examples that might happen in your own life. Imagine it's the first day of school and you're walking into a new classroom. Here's how the cognitive triangle might work. Thought: nobody will want to sit with me at lunch. Feeling: nervous and scared. Action: sitting alone and not talking to anyone. But watch what happens when you change the thought. New thought: this is a chance to make new friends. New feeling: hopeful and excited. New action: smiling and saying hi to classmates. See how changing just one point of the triangle can affect the others? That's the magic of the cognitive triangle. Here's another example. Let's say your younger sibling keeps coming into your room and messing with your things. Thought: they're doing this on purpose to ruin everything. Feeling: angry and frustrated. Action: yelling and slamming the door. But if you change the thought, new thought: maybe they just want to spend time with me or don't understand my boundaries yet. New feeling: calmer and more understanding. New action: having a conversation with them about respecting personal space and finding better ways to play together. The cool thing about the cognitive triangle is that you can make changes by starting with either your thoughts or your actions. When you change your thoughts or actions, your feelings will usually change too. Here are some helpful strategies for each part of the triangle. Change your thoughts. Ask yourself, is this thought helping me or hurting me? Look for evidence by asking, what facts support or don't support this thought? Ask yourself, what's another way to look at this situation? Or practice replacing your negative thought with something more encouraging or helpful. Change your actions. Try doing the opposite of what you usually do when you're feeling unhappy, worried, or upset. Take small steps toward what you want to do. Use calm down strategies like taking deep breaths or ask for help when you need it. Here's another example. Imagine you accidentally break something while playing. Unhelpful triangle. Thought: I'm so clumsy. Mom and Dad will never trust me with anything nice again. Feeling: guilty and panicked. Action: trying to hide the broken item and avoiding telling anyone. Helpful triangle. New thought: accidents happen to everyone, and being honest is important. New feeling: nervous but brave. New action: taking responsibility and telling parents what happened. Let's try.
Okay, so it's a 4-minute video, but hopefully people kind of get the point. And you just have to do this repeatedly with patients until they get comfortable and they'll kind of relapse. So they make changes, then they kind of go back, and that's sort of the normal process. So they have to keep working at this um, over and over again. Okay, so moving on. And there's more variations to this. We adapt cognitive behavior therapy if you're working with little kids, if you're working with adolescents. We can also do this type of therapy with individuals who suffer from chronic pain. And so you have a pain component to it. So there's a lot of different variations. The next one I want to discuss is exposure and response prevention, that it's specifically used for people who have severe OCD. So here's a very common example. If a patient has compulsion of washing hands, what the therapist is going to do is they'll get their hands dirty and basically not let them wash their hands. It's going to, the anxiety level is going to go up, 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 and then it will reach the peak, and then it will start coming down. And you do this again and again and again until that peak, the height of the peak, continues to come down. So again, the anxiety will rise, reach peak, go down. During the rise and the peak, the patients are taught to relax. You teach them to relax, and the anxiety reduces, new learning takes place, reinforcing that the compulsive act does not need to be performed. So you're going to have to teach your brain that. And again, this is just an example for washing hands, but this can be effective for any different type of compulsion. So if a person needs everything clean, you kind of make things a little messy, and then you have them sit with that. So let me show a quick kind of example of what that would look like also. And I'll share this, but I don't want. Actually, sorry, let me fix this first on the Chrome and then I'll share again. Okay, all right, that's better. So this is what I want to share. Okay.
Our main treatment that we use here to treat OCD is exposure and response prevention. And that treatment really has two separate parts. So one part of that is the exposure part, and the second is the response prevention. And so just like OCD or obsessive compulsive disorder has two parts. It has the obsessions and then the compulsions. And so when we are having patients complete exposure and response prevention, the exposure piece is having them face feared situations or objects or scenarios. And then after that is when the response prevention piece comes in, because it's having them do that without following up with their rituals. But if someone has contamination concerns, they may touch something that they think is dirty or covered with germs. That would be the exposure piece. And then the response prevention would be not removing their germs from their hands, learning that this thing that I thought was really triggering, I can actually handle. So we'll have patients create a hierarchy where they'll go through and identify different either situations or objects or particular triggers that might be difficult for them. And then we order them based on our 0 to 7 scales. And then we'll have them move through that hierarchy in a very systematic way. We also like to make sure that they are repetitive. So we'll have patients do the same thing over and over again to really help solidify that learning that's occurring during the exposure and ritual prevention. And once they get the first taste of, I really can do this and I have the ability to do this, it's really cool to watch how quick they start to pick up speed and how quickly they can move through different exposures and get pieces of their life back.
Okay, and so back to this. And this is a very, very, very effective form of therapy. In fact, we recommend it before we would even put medication, but sometimes it's so severe that we do both medication and put them in exposure response protocol. Post-traumatic stress disorder. This is a very complex condition. I talked about it a little bit yesterday. It can be treated with prolonged exposure or cognitive processing therapy. I'm not going to really go into CPT. It's very complex. You have to learn it. But prolonged exposure, I have a short video. It involves therapists working with the patient to remember and write down the events of the traumatic event. And what they do is they read the event out. They actually just read the words. They write it down, they read it over and over and over and over again each time in the session. And the objective is that the event, as the event is relived over and over again, it loses its grip on the patient because it has so much emotional valence the first time it happened. It is overbearing on their brain, on their lives. And then eventually it just becomes smaller and smaller and smaller in terms of how it impacts. So I just want to illustrate that here real quick, and I'll make sure it's up for me, ready to share. And that's right here. Okay. Share this. Yeah.
If you have post-traumatic stress disorder or PTSD, it's common to feel like there are places or situations that are unsafe. It may seem like the best option is to avoid them, staying away from people or places that feel dangerous or reminders of a traumatic event. As a result, you may develop I can't rules. I can't leave the house at night. I can't trust anyone. I can't handle crowds. But these rules won't help you overcome PTSD. So how do you learn to say I can? Prolonged exposure, or PE, is a treatment for PTSD that helps you do safe things you've been avoiding. In PE, you and your therapist will practice exposure, meaning you'll work to approach things you've steered clear of since the event. You have to challenge your I can't rules to prove to yourself that you can. Remember when you were learning to swim or even drive a car? It was challenging at first, but got easier with practice. Exposure gets easier with time. With your therapist, you'll take steps to do the things that have been hard for you at your own pace. So if you're avoiding the grocery store, you might start by going when it isn't crowded, maybe bringing a family member along. You'll eventually practice going on your own, perhaps even during peak hours. With practice, you'll find that you can handle it. You'll also talk through the details of your traumatic event in a safe, gradual way with your therapist. Closing your eyes can help you concentrate. Retelling the event may sound like the last thing you want to do, but it helps with emotions like anger, guilt, and sadness. You'll listen to a recorded version at home too. After a few months, you'll find that you can talk about your trauma without feeling so overwhelmed. Prolonged exposure doesn't erase your trauma, but it can help you keep your traumatic experience from getting in the way of living your life. PE doesn't require you to take any medications. With your therapist's help, you'll follow a step-by-step program for about 3 months. Most people who complete PE show noticeable improvement in their symptoms, and many no longer have PTSD. Prolonged exposure works well for both men and women, and it's evidence-based, which means PE has been proven to work in multiple research studies. If prolonged exposure sounds like it could be right for you, talk to your doctor.
Right, so that's that. Okay, and then getting back. So next I want to talk about medications for anxiety. And these are prescribed by psychiatrists, primary care doctors, really any doctor who is able to prescribe can prescribe these medications, but more commonly by primary care doctors for adults, for kids, psychiatrists, and other specialists will also be prescribing them. So selective serotonin or norepinephrine reuptake inhibitors, so SSRIs or SNRIs, and the common parlance for these meds are antidepressants. Benzodiazepines and antipsychotics. There are some other medications too, but these are the main groups that I thought I could just briefly touch on. So in terms of SSRIs or SNRIs that we use, they are the first-line medication treatment for anxiety. Obviously in the, in the allopathic world, I didn't really include this, but there are some over-the-counter types of things like St. John's wort that people use here in US. And they can work actually well. There's some good evidence base for that, but I'm not going to talk about that here. These are the medications that you actually need a prescription for currently that a doctor will write, and you have to go and get it from the pharmacy. The main SSRIs that we use are medications like sertraline, escitalopram, or Lexapro. In the parentheses is their brand name and all their generic names, fluoxetine or Prozac, citalopram or Celexa. And then in SNRI class, we have venlafaxine or Fexor, desvenlafaxine or Pristiq, duloxetine or Cymbalta. And these are just examples. There's a few others too. These are highly effective medications. They actually work really well. They have very strong evidence base. They're well tolerated by most people. There are some side effects, so it's not side effect free, but it's actually they're pretty good. And one thing is the patients do need to take these meds daily. So this is not something like Tylenol, you just take it when it hurts and you don't have to take it. You have to take these meds every single day. Just to go over some side effects for these medications. So for SSRI, SNRI, the most common one that we tell patients is GI distress, which means nausea or having some problems with abdominal pain and those kinds of things. They're usually mild only in the beginning. If they occur, they go away. Headaches or not, headaches can occur. Some of the more problematic side effects can be some people will experience weight gain, sexual side effects. And then the other thing, at least for me, work with young people, there's a black box warning on these medications for increase in suicidal thoughts in everyone under the age of 26. And that was shown in some studies that were done earlier where it showed that group who received the meds and group who didn't, the one who did had slightly increased in suicidal thoughts. I haven't really seen it in clinical practice. I do share that with the family, the parents, the caregivers. Most of them are okay with it, but you just have to monitor them and they do need to be under doctor's care if they are taking these medications. The next group that I want to talk about are benzodiazepines. So they do include medications like lorazepam, clonazepam, alprazolam. These are the generic names. The brand names are Ativan, Klonopin, Xanax. And some people may be more familiar with those names. They actually can help with acute symptoms of anxiety. So the common reasons to prescribe them are panic attacks. So somebody's having a lot of panic attacks and they're very prolonged. Performance anxiety. So if somebody's going to, give a big lecture in front of an audience or, maybe go take a test or something and they have a severe performance anxiety, you can give these meds and it will lower it. And then for children, severe separation anxiety in children, where they will just refuse to go to school and can give a little bit of the medication early on as they're still starting therapy. So those are some common reasons why we would give them. There are some risks with these medications, so the recommendation is always to be used sparingly and also only for short duration. So these are not medications that you want to just take every single day for a long period of time. The main risks are cognitive side effects because they'll kind of dull you, they slow things down, they reduce the anxiety, and in reducing the anxiety, they can cause sedation, difficulty remembering things, difficulty with memory, falls in older people, and then physiological dependence. And what that means is it's sort of the other version of addiction, which we typically think of psychological dependence, in that your body gets used to it and then you need it. And then if you don't get it, then you're going to have withdrawal symptoms, which physically makes you sick. And we don't want patients to become dependent on these medications. So that's why I use sparingly and only as needed. And the last group of medications that I wanted to talk about today are antipsychotic medication. We don't use them very much, but there are some people who do have severe anxiety that you do need to use these medications. The examples include quetiapine or Seroquel and risperidone. There's other medications too. They're used to treat severe anxiety. It's resistant to all the first-line interventions, and it's just to the point that the person's not able to function in their day-to-day life, and they can be helpful. The side effects of these medications include weight gain, lots of weight gain for all of these metabolic abnormalities. So that means cholesterol problems, glucose problems. So we have to check those labs and monitor them. And then they can also cause abnormal movements. With the newer medications, not so much, but also it is something that we want to pay attention to. I wanted to include a little bit about complementary interventions for anxiety because there's strong evidence base for a lot of these, and we do actually recommend our patients to engage in them because they're very helpful. Even, excuse me, even when they're taking medications, they can be very effective. And the three that I want to highlight are exercise, meditation, and then also spiritual, religious healing practices. So exercise for anxiety, very good evidence base. 30 to 40 minutes, 3 to 5 times weekly. So that's a good commitment. That's not just here and there. That's very consistently exercising. It can optimize anxiety reduction. Both low intensity and moderate to high intensity exercise have shown in studies to improve anxiety symptoms. And then exercise can work well for both adults as well as young people. So adolescents. With kids, exercise is more like physical activity. So just making sure they're active, they're not just in their rooms. But for adults diagnosed with anxiety, exercise can be very, very helpful. And all these things are nice because sometimes it means the patients don't have to take as much medication, fewer medications. And if they do better, they can come off the medications and stay off of them just from doing exercise and other interventions. Meditation is also a big one. There's a lot of studies now. There's formalized, manualized treatments that incorporate mindfulness-based stress reduction. MBSR is one of them. Mindfulness-based cognitive therapy is also another one, and they both have evidence-based to produce improvement in anxiety. And they use rating scales completed by patients and clinicians. Some things to keep in mind, mindfulness-based interventions, they do work better when they're delivered by trained instructors as opposed to just doing it via app or internet-based. And that sort of makes sense because sometimes with app, you don't know what you're getting and you don't really have a person who can help you out or, make adjustments as necessary to your practice. The benefits in the studies are usually short-term, so they can last up to 6 months, and then it's unclear if the benefits will last term. They do work for anxiety symptoms, but not necessarily anxiety disorders, and that makes sense because they are not going to change the underlying sort of thinking patterns and distorted thinking, and those types of changes that are going to come from more specific therapeutic modalities that I was talking about. But they're good for general symptoms of anxiety and can be very helpful along with medications. And again, the advantage for both of these interventions is that you're not going to have side effects. Spirituality and religion, there's some data for that as well. One of the meta-analyses in older adults, they found that high religiosity and spiritual beliefs was negatively associated with anxiety symptoms. And what that means is the higher the religious beliefs, the lower the anxiety symptoms. And then specific religious spiritual dimensions that people have looked at in studies um, show or have more higher focus on these beliefs around peace and faith. And it sort of makes sense because a lot of anxiety is this out of control thinking and spiraling out of thoughts about bad things happening. Bad things are going to happen to me or other people, or just everything's going to be bad. And I think when you have faith or belief in something higher, that can protect against that intense fear that is under a common denominator for a lot of anxiety diagnoses. And that's it. I wanted to keep it simple. These are the references, particularly for the data around exercise, meditation, and religious based. The other things I'm very familiar with, the medications and treatment types. So um, I will stop share here, and I'm open to taking any questions or comments.
Hello, Dr. Anuja. This is Rakesh. Hello, can you hear me?
Yeah, I can hear you. Go ahead.
Okay. All right. No, my question was around how do these medicines work? You mentioned the antipsychotics.
Mm-hmm.
So how do these medicines work? If we understand where and how they work in the body, maybe we can correlate them with some meditation or pranayam and other things. That's the basis of my question.
Yeah, that's a great question. And I'll tell you, people have done research in this for years. I think we have clues, but I don't think there's full understanding of how these medications work because brain is a big mystery, which is why I've been fascinated with neuroscience. I think the earlier understanding that we have for all these medications was this monoamine hypothesis that people who have depression have problems with these neurotransmitters in the brain. So, like dopamine, norepinephrine, serotonin, all those ones. And at the molecular level, we do know that these medications put out more serotonin in what we call the synaptic cleft, the space between the two neurons. That's where neurons communicate with each other. So that is known. And then antipsychotics are very complex. They do different things. They block dopamine. They're dopamine antagonists, but they're also serotonin agonists for some of them on different. So they do so many different things. There's other research that has shown that it stimulates brain growth, BDNF, which is brain-derived neurotrophic factor. So if you take these meds for a period of time, it actually stimulates more dendrites. So the neurons are, branching out more, and those are good things. We also know that psychotherapy does that over a period of time, that you'll see dendritic growth and on a neuron. So we have some understanding of how these meds work. I would say we don't have a full understanding of them exactly, but this is what we use to explain patients when they ask me. This is exactly what I tell them. And I say they are very effective, they work well. And again, you're always balancing risk and benefit. So there are some risks with them, there are some side effects, but if they're really, really struggling, then that's what we explain to them that, you're going to derive some benefit. Unfortunately, I cannot comment on how pranayam can correlate with what's happening in the brain, but hopefully that answers your question about the medications, or at least what we currently know of them, how they work.
Yeah, yeah. So alprazolam, you mentioned, it should be, is it addictive? Does it
Yeah,
lead
it's
to addiction?
Xanax. Alprazolam is Xanax. Or some people
Yeah,
may have heard of that, but they are
right.
GABA.
Yeah.
They are GABA agonists, so they promote more GABA and they kind of just slow you down. They relax you. They can help you sleep. But if you take them every day, you can get dependent on them. These are very addictive meds. Yes.
Okay.
So, Dr. Anuja, I have a question, right? So,
Yeah.
whenever the patients are on a medications, then how is their behavior? How we know that they are taking medicines regularly or?
Yeah, so they have to take medicines on their own. They will tell us they're taking it, so we have to take their word for it. If they're not, then you're not going to know. Um, if the question is what happens after they take the meds, right? Like what happens? I take these
Yes.
meds, what's going to happen? For me, that's the most rewarding and gratifying aspect of being a doctor or psychiatrist because I see a difference. They'll tell you, and these are patient story after story. Oh my God, I took it for a week. I'm suddenly feeling better. I'm not worrying all the time. I'm actually able to go to work. I get ready, I'm out. Like I'm not in the room all the time. All different versions of this. And you can see them. When I see them, actually, their affect, their facial expressions change. So you can see that. And then in some cases, when they're kids, their family members will say, they're like, oh my God, night and day, night and day. My kid is so different. Um, it's not true for everybody. And then there's other data which shows, there's 2/3 response. So for every 3 patients, 2 will respond, 1 will not. 1 will have nothing happen or have side effects, and you got to, try other things. But uh, 63, 66% response is not bad. So yeah, you feel better. I just say it's the same thing. You have sore throat or you have um, throat infection, then tonsillitis or something like that, and you take an antibiotic, you just feel better. If it's a true antibiotic, I mean, bacterial infection. And this is very similar in that way. I mean, it's different in that it's more chronic. It's not necessarily going to be cured and go away, but it can be managed. Whereas like a strep throat or something like that, you get it, you take your meds for a week, and then, that's gone. But there's a very good response. People do really good from these medications. It works for a lot of them.
And with this one, I have another question, right? Because we are in a yoga one. So if the patient took those the medications within a half an hour or hour during before our sessions ones, does it has any adverse impact or do we have to take care anything?
No, no effect. Nothing that I'm aware of. You should not have any problems doing yoga before or after.
Okay.
Yeah.
Hi, this is Sachi. I have a quick question. I know when you were CBT was referred to as like the treatment for like GAD and other kind of generalized anxiety. Is that the only non-medical treatment, or is that just the main one that's used? And if it's the
That's the
main one,
main one. That's the main one. There are others. Yeah.
what are some of the other ones?
So mindfulness-based cognitive therapy, you can use that. CBT is like one of the main ones. You can use supportive therapy. There's just different sort of variations of that, but CBT is really the mainstay for anxiety. If you have anxiety and depression together, then you have more options. You can do interpersonal therapy. So you have a few more options in that way. You can do psychodynamic therapy. That's a whole different therapy that's very difficult to learn. That takes a long time to train yourself in, but you have some other options if anxiety and depression are together. If it's anxiety by itself, CBT tends to be the best option.
Gotcha. Thank you.
Mm-hmm.
So thank you, Anuja, for both the
Thank you.
wonderful talks. This anxiety topic is really very crucial, especially in even the young children, or you can say the college going kids. And I have done some experiments on them, and I have found that most of them, they feel that the anxiety is there, but when they start practicing mindfulness or any meditation, they feel that they are getting very relaxed by that, and their life is settling before they were not able to manage the things. So this mindful meditation has a lot of effect on such kind of people, those who are having anxiety. And positive thinking. So you have already shown some videos that how you can develop your positive thinking. So the whole scenario gets changed by that. So this is also true. When somebody starts thinking in that way, then he can easily come out of this anxiety. So to live in the present more and more is more necessary for such people who are having such kind of problem of anxiety or depression. I have so many research paper, you can say, or the assignments I used to give to my students to write on some paper taking some disease and how meditation is affecting them. So most of them have written on anxiety and they have shown that how meditation has helped them. So I have so many such case studies.
Yeah, you're right. I think you're absolutely right, Samniji. I believe in those myself too. And we all struggle with anxiety from time to time. I've had struggles with anxiety during medical school periods. So again, it's one of those things it comes, it goes, it comes sometimes. You can treat it. And also giving yourself a break to realize what thoughts you're having. Because often thought, reaction. And I think people talk about that in Jainism, right? Like we react quickly. And part of teaching them CBT is create a space, a separation between your thought, what you're feeling, what you're doing. Just slow down. And if you can train yourself to do that, you'll catch yourself quickly. I don't need to be thinking that. That's not what the other person is doing. My mom's not trying to attack me. My husband's not really against me. It's okay, So, no, you're right. These things are very helpful. They do take time to learn and practice, but if you can do them, they'll really help people tremendously.
Yes. I can share some of the articles of my students of FIU, how they have seen that how meditation is playing crucial role in their life, at least to come out from the anxiety. Yeah. So thank you very much for both the wonderful talks, and you have shown very good videos. So they are making very clear the concept, the medical concept. Otherwise, it is difficult to understand the terms of the medical science. But they are explaining very well.
Yeah.
Thank you.
Sounds good. Yeah. Thank you, Samniji.
Yes. Okay, so today, who will give the session? Narendra Ji. Who is giving session?
Mandami Namaste, Samniji.
Yes, Narendra.
I'm doing exercise. So we'll warm up few minutes. Raise the hand, press the fingers, and raise upwards on the toes while breathing up. And when you relax,
The video should be open to see.
Samniji, my video is not working today for some reason.
Okay.
can you see?
Mhm.
I'm using my mobile phone, not the laptop.
Okay.
So we'll little warm up. So raise the hand and place the fingers and raise on inhale and rolls on the toe. While exhaling, bring the hands on the side again. Inhale, lift the fingers and finger palm facing upwards on your toes. Then relax and exhale. One more time. Inhale. Now we will do the eyes exercise. We'll when inhale, we raise the eyes toward and forehead upwards. While exhaling, we bring downwards. Again, inhale. Inhale. We will do 5 times this exercise.
I see it now.
And then exercise we do inhale, and when you release, squeeze the eyes lids. Inhale, and when release, close the eyes. This strengthens your eyes muscles as well as increase the brightness in your eyes and release the tensions. Now we'll do the eyes exercise. When we inhale, look up. When you exhale, look down towards the feet. Inhale. Exhale, look down towards the feet. Inhale. Exhale. Inhale. Exhale. Now while inhaling, take the eyebrow towards the right corner, and while exhaling, take the eye towards the left corner. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now we'll do inhale in the left corner, up, and when inhale, exhale, we do right corner on the bottom, downwards. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. The next exercise is to rotate the eye first in clockwise and then anti-clockwise 3 times. Up, right corner, downwards, left, up, right corner, right side, down, both, left side, up, right side, bottom, left, up. Now we do anti-clockwise, left, then bottom, then right, then top, then again we go left, right, down, then right, then top, then left, bottom, right side, and top. Now we do ear exercise. So we twist put the fingers, middle finger in the ears and rotate first right clockwise and then anti-clockwise. Next is to like acupuncture for the ears. So we pull the ear upwards, then sideways, and then downwards. So it will massage all the points of the ears. Now you rub the hands and create the heat and close the eyes and put the palm on and cover the eyes and let the heat goes into your slowly blink your eyes so that heat goes into your eyes. And gradually pull the hands down. Rub the hands again. Now we'll do the mouth exercise. So we breathing and blow the mouth cheeks outwards and release the air with clenching the teeth. We now clench the teeth and breathe in the cold air, like it will like a sound of waves, of oceans of waves. Now we can open the mouth and put the three fingers like that. Now we'll do the head exercise. When inhale, take the head backwards. While exhaling, bring the head downwards and touching the chin towards the chest. Inhale. Exhale. Inhale. Inhale. Exhale. Now we'll do the another exercise. Inhale and turn the head right side. Back. Exhale on the left side. Inhale. Front. Exhale. Now we do the reverse side. First, inhale on the left side, then exhale on the right side. Inhale, exhale. The next exercise is inhale and bend the head towards the right side. In exhale. Inhale. So you get the stretch from your neck. Now we'll rotate the head in the first clockwise and then anti-clockwise 2 times. So when head goes down, exhale, and when head goes upwards, you inhale. Now we'll do anti-clockwise. Now we'll do the hand exercise. Stretch the palm up, exhale, down. Inhale up, exhale, down. Inhale up, exhale, down. Inhale up, exhale, down. Now we'll rotate the palm clockwise first, keeping the arm straight, then anti-clockwise. Relax. Now we'll do the shoulder ones. Raise the shoulder when you breathe in. Exhale up and down. Inhale, shoulder up. Now we exercise with the fingers. So do one at a time. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now we do the shoulder ones. So put the fingers on top of the shoulder corner and then rotate clockwise and then anti-clockwise. Now anti-clockwise. Now we on when inhale, we raise on the toe. Exhale, we come down, and inhale, toes goes up. Inhale, rise on the toe. Exhale, and then raise the toe and balance on the heel. Now we do the knee exercise. So the palm on the waist and bend and put the leg on both the knees facing towards the right side first. Inhale, stand up. Exhale, facing the knees facing right side. Then we can same thing. We inhale, exhale, bend the knees, and knees facing left side. Then we can rotate the knees. So bend down like a chair pose and gradually do the rotation circle, keeping the waist straight. We'll do the abdomen exercise. Breathe in, and then when we breathe out, bend down 90 degrees, and we have to push stomach in and out with while holding the breath. We got like 10 exercise in the abdomen ones. So first one is to do breathe in, breathe out, and push abdomen in and out. Then we can go into 30 degrees, same thing. Then we got 90 degrees. Facing the face toward the wall in the front. Now we'll do 90 degrees. One more time in 90 degrees. Now when we do 30 degrees, we try to rotate the stomach as much as we can. Try to do rotation, so going like a circle type, or right to left.
Okay, so how was the exercise?
It was excellent, Samniji.
Yeah, it was
That-
excellent. Excellent
Yeah,
session.
excellent. Excellent. Just beautiful. Your stomach exercises were just excellent. We can see the stomach going in and out very clearly.
Yes. He has moved rotate
The
his
movement, yes.
very well, and all the exercise instructions were very good.
Wonderful.
So now you can start giving some session to the what you say Adi and the small kids.
Yeah.
What they should learn the stomach exercise, and they can learn easily.
Definitely. Asa
They will
learning
enjoy.
exercise little bit, right? Asa is learning little bit hand exercise.
Oh, okay. No, it was good session. So next, who is left now? Shachi has given session?
No, I'm going on Friday.
Friday, okay. And
Yeah, I'll do
anybody
Thursday.
else?
I'll do Thursday, then I have to still prepare, but Thursday I can do.
Thursday?
Hmm.
Okay, so you have taken contemplations of
Yes.
on
Right.
tolerance and other forgiveness. There,
Yeah.
there are four spiritual contemplations.
Yeah, in this book, Samiji, right?
Yes,
Okay,
it
yeah.
is. It is
At the
given.
back,
Yes.
they have fearlessness, endurance, modesty, straightforwardness, and content.
Correct.
I'll do those.
Correct.
I'll do those.
Yes.
Okay.
Nainaven has already given.
I just
And
started
now
that one.
Sheetal has not given? Or
Sheetal
she has given?
maybe busy because the mother's got surgery.
Yeah, I know.
When
Her
she comes
mother
back,
has got surgery today, no?
yeah, when she comes back, probably.
Yeah. Shivani has given the session.
Yes.
Hmm.
She did
I
good
will
one.
tell
Yes, she did yesterday.
Samniji and Binaji, they should also. Suril has also given.
Yeah, Samiji Binabi, and then if Papari, when she's back, she still wants to do it then. He was fine to be back.
Sorry?
Dinesh Bhai.
Yeah, Dinesh is also has to give. But he has left for India, is it?
Yeah, he's in transit probably. He was saying.
But he can do it after 2 days. He'll be able
Yeah.
to attend after 2 days.
Yes. Meanwhile, we will you will give and Sachi will give session.
Yeah.
Okay. So thank you very much. All have learned very well. Yes.
Yeah, it's good. I'm seeing progress. Quite pleasure to see. It's quite nice.
Yes.
Quite.
It's really, really well done, Narendra Bhai. Very good. Going through all those exercises. It woke me up.
Yes.
It was good.
Yeah. Monday's exercise, Samiji, you should, one on
Thank you.
Monday, you may want to see and give feedback, Samiji. Monday, who did the Monday exercise?
Monday exercise.
No, who did that? Is it
Shivani.
Suril or?
Monday
Shivani,
was
Oh, we gave
yesterday.
feedback already.
Yesterday,
She did
right?
very well. Shivani did very well. Yeah, we gave her feedback on Monday.
No, it was it was yesterday, no?
Yes.
Yesterday, I'm sorry.
Yeah.
Yes. Shivani,
Yeah.
yesterday, yes.
So, yeah, I forgot actually that there is class, and that's why I could not be present. But I will see the video for scoring. Yes. Suril's session I could not see, and Shivani's session also. Okay, so now be ready for the final exam. We are proceeding towards that.
Samniji, one question.
For the quiz, so therapeutic part, you have to be very much clear about that. What doctors has said to you, okay, about the treatment and the symptoms. So that should be in the mind, at least. So you can start listening to their lectures. And there is the presentation. You can include the reviews, research, review of the research on the yoga practices pertaining to particular disease. So that Dr. Devendra has already dealt with all those topics related to all the health issues. So just you can include those review research review of the research in your presentation.
Okay.
It is not for the quiz. Okay.
So I have a question about the presentation, Samniji. So we did pranayam, no, sorry,
Yes.
meditation, and I was assigned the internal trip Antaryatra. So am I doing a 10 or 15-minute PowerPoint presentation on the same meditation, or is it a different list?
If you prepare any other meditation, I have no problem. Just you have to give one presentation.
One presentation on any meditation.
Yes. Yeah, on any meditation. Just because those people who are looking for particular meditation, so that's why I told that whatever you have taken for chosen for your presentation, you can give meditation only on that.
On the same one. Okay.
Yeah. So the practical part you are covering, which on the meditation which is given for your presentation. But if somebody wants to prepare some other meditation for their presentation, I have no problem. Just I want to
that's
see
fine,
how you are
Samniji,
presenting
because-
the things.
Yeah. Yeah, that's fine. I can do the same because that would avoid duplication.
Yes. Yes. So that's why we have divided the different topics of discussion through presentation, so that everybody could come to can learn from you. If you are presenting the same thing and the other one is also presenting the same thing, so there may be some new things to learn from everybody. But instead of that, if we can give some different presentation, then everybody would learn from you
Right.
how they can present the same thing. So it would be good for them also.
Oh, I see.
Okay. And they can ask any questions. So the presentation will be done in the class. Everybody would be on a screen available or in person whenever they will be in the center. So they have to give the presentation in front of all the participants and they can ask any questions. Okay. To the presenter.
It will be live. That's what you're saying, Samniji, not Zoom.
Just what, Naina, we have decided?
So I think we had decided that we're going to be doing the presentations on the exam week, so that weekend. So for those who are in person and here, we'll present it to the class, and the others who are not going to be available that weekend will join on Zoom. And if they're doing their presentation, they'll give it on Zoom, but we will be doing it live. So Samniji, I think for time constraints for everyone to present, I think it should be a 10-minute presentation, leaving some time for question answer at the end.
Yes.
So that's maybe like 10 slides. If you say like a minute per slide, that should be more than enough for everybody to show their techniques in how you can present a topic, which is what Samniji wants to see. So I think we'll have the exam first, and then we'll follow that by the presentations. And I know, Sachi, you have time constraints for that day, so we might just have you go first, so that you can go and get on with your activities. So exam, so Somniji, I think the exam is, I have given 2-hour slot for the exam. Is that, I will talk about whether that's more than enough time, or we can just do 1 hour for multiple choice questions. So I don't know whether 2 hours is a long time for just
3
multiple
hours,
choice.
Anuja, 3 hours Anuja will take for her exam. And 3 hours I would take it. I think it would be 10-10. So there are 12 people.
So
So 2 hours, 2.5 hours, I think I will take, so around 3 hours. So we would have hardly 2 hours for the exam.
right. So that's more than enough, right?
Yeah, more than enough. It is
Yeah,
more than
because
enough.
if it's multiple choice, I think even how many questions we're going to have, I think it'll be enough for that. I think Anuja will we can do exam on Saturday with you for the written and the presentations, and then the whole day Sunday Anuja can just do the asanas, if that's going to be making it easier for her and for you. But we can it might be asanas a little bit on Saturday as well. And we might just do half days and half days. I haven't actually spoken to you or Anuja probably to see whether we want to do a half a day of asanas. So we split the group up. That might be more better for Anuja. 4 hours on one day and 2 hours on one day and 2 hours on the other day.
Okay, so she will take she needs more time for it.
She needs
for
4
exam.
4 hours. She will need
4 hours. Okay.
Because it's going to be 15
20 minutes.
Sorry, 20 minutes per person. So 15 minutes of their doing it and then 5 minutes to score.
Okay, so she needs 4 hours, then I have 4 hours. So 2 hours for all the presentations and
2 hours for the exam. Yes.
Yeah, for exam.
I did a brief thing like that on an Excel sheet, which is on the form.
Since it is a quiz, it doesn't take much more time. If we think that there should be hardly 30 questions or 50 around, then it will take hardly half an hour for taking the quiz.
So
it doesn't take much time. So
right.
I can give my time for presentation.
For the presentation for long. That's what I was thinking.
Yeah,
Maybe
so,
1 hour for the exam, because it's if
she
we're
can
not
take
doing
2
any other
hours,
questions.
and
Yes.
if possible, we can start taking presentation on Saturday for 2 hours and next day for 1 hour.
Okay.
And 1 hour for quiz. That is enough.
Okay.
It doesn't need much time because here it is the multiple choice questions.
Exactly.
So you don't take much time.
We're not doing anything
fill
else.
within 10 minutes or 15 minutes.
You either know the answer, you
somebody
don't know the answer.
Huh?
You either know the answer, don't know the answer. Time doesn't help.
Yes.
So 8 to 9, we
in
can do the
India,
exam first thing.
we take in written exam and explanatory answers. So you need 3 hours almost to
Yes, we're
complete.
doing other things, but this is just multiple choice.
And then
Here
again,
is here people are so what we say fond of taking just the multiple choice questions, even the university level. Otherwise, in India, we take essay type answers. So you have to write down at least 4 to 5 pages to answer one question. And there are almost 5 such questions which are given in final exam.
Yeah.
So 3 hours are required. It is also less for them because we always ask for essay type of question answers. Okay, thank you very much.
For the quick question, for the presentation, are we presenting as if like we're presenting to a class of students and just explaining that type of meditation? Or are we presenting it like we're presenting it to other instructors and how we would do it and like how you would like direct the meditation? Or is it just more like the theory of why we do that one or more background information about it?
Yeah, I think she wants the more theory and background and any research things that you can put into it.
Okay.
Yeah. The practice we're doing in practice right now to show, but then that's going to be more the theory.
Okay, thank you.
We do have a review for several days prior where we'll go over all the material again. So I think you'll have clues of what might come on the quiz.
that'll be great. Thank you, Devendra Bhai.